Hi, Morgan. It's Max Garcia. Let me start by saying that this presentation went above and beyond what I've seen so far and my expectations. And I've seen some really good ones. Now, your topic was reducing the maternal morbidity and mortality rates via mandated implicit bias training and culturally responsive training. Off the rip, I'm sold. It was really nice to see you at Professor Rosen's presentation day. And due to the nature of your topic, I'm already on board. So you defined your purposes as improving patient safety. Love that. Reducing disparities. You know that's my thing as well. And strengthening equitable care. The issue that you highlighted was ethnic disparities in maternal health care. Your policy, I love the title. And I was curious, does your healthcare organization offer this type of training? At St. Luke's Hospital in Kansas City, Missouri, they just started, I think last year, we do receive training on implicit bias. For your evidence section, great inclusion of graphs in the very beginning slides. And thank you for using citations in the body of your presentation. Also, I thought the point where you intersected ethnic disparities with rural populations was very effective. Additionally, the inclusion of financial and insurance considerations effectively frames your proposal. I also picked up on the part about the March of Dimes Innovation Fund. Very effective. As far as opposition, because we know there will be some, your comments about some objections due to the political connotations of your subject matter reminded me of our current Secretary of Health and Human Services. I've seen him on more than one occasion skirt the issue when an interviewer asked him about, no, actually it was a senator, I believe, asked him about, maybe it was a representative, anyway, asked him about the disparity in Black maternal mortality and morbidity rates. And he acted like that was not a concern or something that should be just part of a broader subject. In any event, I didn't really have too much to say about your House and committee selection. I thought those parts were very well thought out and logical. As far as lobbying, I was impressed with the inclusion of healthcare provider and patient testimonies as a means of gaining support for your policy. I don't think there's any better tool, actually. And finally, for your media engagement, you made a very intelligent point about keeping your messaging evidence-based and on topic and practical to try to minimize the politicalization of your message, even though that's going to happen to some degree. All in all, this was my favorite presentation of the few that I watched. So well designed, so well thought out and put together. Congratulations. I can actually see your policy becoming a law. And I hope it does. All right. See you later.